Welcome to Thursday's Sciatica Solution. If you have sciatica, this is for you. This is going to help you. We're going to help you because you're going to better understand what sciatica is, but also some tips. So today we're going to talk about, we do this because doctors don't have to report the results of their treatment, and because they're not obligated to report the outcomes, it's hard for you to identify what treatment is best for your problem. And sometimes you get treatments that are not effective for your problem at all. So our goal is to help you make better decisions about your health care. Today we're specifically going to talk about the pinching of the nerve as it exits the spine. That's called sciatica. 54-year-old female, back pain and sciatica for 9 years. So not a new problem, long ongoing problem. And the one thing we know is the longer you have the problem, the more wear and tear you get on your spine. The problem, as they call it, my back pain that I've had for 9 years, that's an indication something's breaking down. It's called the degenerative cascade. And part of the degenerative cascade is the degeneration of the disc, but also stenosis. Excuse me. So, patient came to see us. She saw 2 doctors before she saw us. She had an MRI. She had 4 cortisone injections. She was taking hydrocodone, which is the narcotic, and non-anti-inflammatory steroids. Okay? Our process, well, she went through these and did not get better. So the outcome for these treatments was 0. No good. Because she still had the problem. We have a 9-step sciatica solution. Part of that solution is identifying what's pinching the nerve. It's proprietary, it's patented process where we identify exactly what's pinching the nerve. She came in to see us, we did a diagnosis, degenerated disc, bulging disc, stenosis, and sciatica. These 3 are part of the degenerative cascade. Break down slowly over time. She had 3 of the 5 causes of sciatica. We have a video on that, and that'll help you better understand. I'll just go through briefly what her causes were causing that pain down her leg. Number 1, she had a degenerated disc. Degenerated disc is where the vertebrae physically get closer together and you start to get pinching of the nerve as the nerve exits through the spinal cord. She had a bulging disc where that disc was pushing a little bit into the spinal canal. And she had stenosis, and stenosis is where the bones physically start to change shape as a result of the change in the load over time, which is part of that degenerative cascade. So she had a lot of things going on there causing that pinching of the nerve. Our goal is to take pressure off the disc. So we have to wear a harness. It's called unweighting, and we just take a little bit of pressure. We're not pulling it apart. We just take a little bit of pressure, and then we start to get healing along the annulus and healing in the disc. And we're freeing up the space, most importantly, where that nerve comes out. The key to eliminating sciatica and back pain is taking the pressure off the disc and freeing up that space. So in her case, that's what we did. When she came in to see us, her back pain and sciatica was a 10, which is as high as it can get, and that was post both injections and post the narcotics. A 10, that's as bad as it gets. Her oswestry was 56. It's 5 categories. She was in the middle category, which is a pretty high category, okay? Severely disabled. The oswestry disability index is a variable of how disabled you are. Severely disabled for an extended period of time is 100% of a surgical candidate. She was a candidate for surgery. She chose not to have surgery. She came to see us. Ours involves no drugs or no surgery. It's advanced physical therapy, decompression of the disc, taking pressure off the disc. Okay, it's unweighting is what we're doing. After our program, her back pain was a 2, her sciatica was a 2, and her oswestry was a 12. So we got her living a functional, stable life. Okay, eliminated almost all the pain, feeling profoundly better. Got her out of that category into minimal. Anything below 20 is what we call the safe zone. So she was feeling better. Okay, that's the outcome. So how do we know what happened? She improved her pain by 8 points, and she improved her oswestry disability index by 44 points. Okay, that's the outcome. How much improvement did you have as a result of the therapy? I'm going to give you 2 tips. These are tips that we've gone over more than one time, but why do we give the tips? Because when you have a spine that's unstable and you continue to put it in a position that makes it more unstable, the pain comes back. Our goal is to make sure when you're better that you are better. The first tip is what we call the micro break. When you're sitting at a computer all day long and you're like this, and you're typing, what happens is your spine starts to go like this and gets stuck in this flex forward position. And what that does is it overloads the discs. And when you overload the discs, you're causing more trouble. So what we call is the micro break. And once an hour, and if you can do it once every half hour, it's fine. But you want to scoot to the edge of your chair. And when you scoot to the edge of your chair, what you do is you have your knees pointing out on an angle like this and your feet on that same angle. So my feet and knees are doing this. And then I scoot to the edge of the chair and I put my arms down by my side and I sort of let them hang down naturally. And then what I do is I take my palms and I roll them out. What that does is rolls my shoulders back. So palms down, shoulders out, head up, just like this. And what that does is it gets you in proper alignment. If you do that all day, once an hour for 2 weeks, you can completely reprogram your posture. Okay, if you do it once a day, it takes longer. If you do it a couple times a day, it's still gonna take a while. But if you do it once an hour for a couple, 2.5 weeks, you're gonna retrain your posture. So then it becomes a habit. As opposed to you don't have to do this for the rest of your life, although it's not a bad idea if you sit a lot to do this once in a while just to sort of let those tissues relax. That's the micro break. That's tip number 1. Tip number 2 is how to breathe. People breathe wrong. Not everybody. A lot of people breathe wrong. They breathe through their chest. Breathing in and out here, expanding my chest is not how I should be getting air into my lungs. I should be getting air into my lungs by, as I breathe in, my stomach should go out. Okay, when you breathe from your chest, it's called paradoxical breathing. You're breathing the wrong way. And people don't breathe from their stomach because they're holding their stomach in. Kind of like I'm doing right now. Holding my stomach in. Why? Because we don't like to have our stomachs hang out. We live in a culture where our stomachs don't hang out. So but you're holding your stomach in all day long, you're never really allowing your lungs to fully expand and you're chest breathing, and that's not good. So what I tell people is put your hand on your chest right here, on your sternum, and put a hand on your stomach, and as you breathe in, the stomach hand should go out. So as you breathe in, the stomach should go out. Like that. Stomach goes out, and as I breathe out, stomach goes back in. If I'm breathing here, that's not good. You want to breathe down here, because when you breathe from your chest, it causes neck problems, shoulder problems, chest problems, and back problems, because the muscles in your back never relax. And muscles in your back, when they don't relax, they overload the disc. That's our goal. Those are the 2 tips. Why do we do this? We do this because people don't know what they're supposed to be doing. This is what you're supposed to be doing. This is the best for your spine. Make sure you breathe right. Make sure you're getting the micro breaks. If this information is helpful, we want you to subscribe to our page. Okay, we're going to do these tips every day. And why do we do this? Because we want you to understand that you have options. There is other options available for you. How do you identify it? You identify by outcome. We've expressed some of our outcomes. We're up to almost 800 case studies, and over the next 4 weeks, we should have another 200 case studies ready. Okay, that's a lot. So patients get better. If you like us, subscribe to our channel. Share this information with your friends because we can help them. People are suffering right now who don't know that we can help them. That's our goal. I'm out for today. We'll see you tomorrow. Thank you. Be good. Be safe.